One key insight that I gained from the Professionalism in Nursing video regarding professionalism in nursing and communication with other nurses and doctors is that both carrying yourself in a professional manner and communicating in a professional manner is not only important for effective collaboration, but also contributes to increased patient outcomes. If you are difficult to work with or hard to communicate with, this can create challenges for you and your patients, you and other nurses, and you and other members of the care team. Lack of professionalism can result in distrust from your patients, avoidance of communication from other staff members, and will ultimately decrease the quality of care for your patient. According to a journal article titled, "What is Nursing Professionalism? A Concept Analysis," authors state that, quote, higher levels of professionalism can improve nurses' autonomy and empowerment, increase their recognition, and facilitate organizational citizenship behaviors, establish nursing care standards, and even improve quality services, unquote. This analysis shows us that professionalism does not only impact the nurse, but the healthcare organization as a whole. Through professionalism, nurses can gain the respect from other staff members to implement the necessary interventions needed for their patients. They can develop better relationships with other staff members, and they can contribute to better patient outcomes and a higher quality of care. It is imperative that as new nurses enter in the field, we continue to strengthen our professional skills and conduct ourselves in a manner that creates a safe healing environment for our patients. This course contributed to my preparation for a career as a nursing professional in numerous ways. From our lectures, such as incivility in the workplace, to getting to hear insight from a guest speaker who is working in the field and has a successful nursing career, this course has given us the necessary tools and served as a guide as we transition from the role of a student nurse to a new graduate nurse. Courses like these are imperative to give students a glimpse into life as a registered nurse and bridges the gap between being a student and becoming a healthcare professional. The most beneficial aspect of this course is the hands-on experience. Nursing in the classroom is much different from nursing in the field, but having the opportunity to apply the knowledge and skills that you have learned in the classroom is extremely beneficial as you grow your confidence and critical thinking skills. Practicum experiences gives you the opportunity to practice patient communication, skills such as medication administration, time management and planning out your shift, and more. This opportunity allows students to at least grow comfortable being on the floor and interacting with both patients and other staff members. This eases the transition into their new graduate job and can aid in minimizing some of the anxiety, even though it is ultimately inevitable. In terms of obtaining certifications, this course highlights the importance of continuing your education and earning certifications. Not only does this improve your nursing skills and make you a better candidate for higher paying positions, but it will further your ability to make an impact in healthcare. This insight and encouragement fuels my excitement to continue my education and put myself into a position where I can advocate for my patients on a higher level. Overall, I believe that practicum courses are extremely relevant and directly related to the success of nursing students. According to a study titled, "Final Clinical Practicum Shapes the Transition Experience and Occupational Commitment of Newly Graduate Nurses in Europe, a longitudinal study," researchers stated that, quote, having a good final practicum before graduation can contribute to an easier transition experience for new grad nurses and strengthen their commitment to the nursing profession, unquote. The hands-on experience that practicum provides gives students the opportunity to grow more confident in their nursing skills and can help with their transition from working with a preceptor to working as an individual nurse. Having courses like this is very helpful as you navigate a major as hard as nursing and even reminds you of your love for the profession. I believe that all students should have the chance to participate in a practicum course and improve their nursing skills before starting a new graduate position. The Senior Nurse Practicum course has impacted me as I prepare to enter the nursing profession because it has given me the opportunity to get more experience in the hospital and grow more comfortable with skills that we have learned throughout nursing school. Through my practicum experience, I have gained more confidence in medication administration, patient education, communicating and interacting with patients, feeding patients, admitting and discharging patients, and completing nursing assessments. Although these are some of the fundamental skills that we first learn when entering the nursing program, it is much different simply discussing these skills in class or doing a simulation versus completing these actions on a real-life patient. I had patients ranging from alert and oriented ×1 to patients who were completely aware of their surroundings. This gave me the opportunity to practice different communication techniques and learn how to engage with the patient despite what state they may have been in. I also had patients dealing with a variety of diagnoses, such as sickle cell crisis, altered mental status, tuberculosis, diabetic foot ulcers, and dementia. I was challenged with properly prepping to provide individual care to each patient and work with my nurse to implement the necessary interventions to improve the health statuses of each of our patients. Each shift, we would get 5 to 6 patients. Although this was both daunting and overwhelming at times, it allowed me to practice my time management skills and make sure that each patient was receiving the required care at the right time. This allowed me to begin developing methods of staying organized and helped with my ability to prioritize. I even observed practices that taught me what I do not want to do once I become a new graduate nurse and will help me avoid making the errors that I witnessed on the floor. For example, I will always make sure to complete all medication administration rites each time that I go to administer medication to my patients. I will also make sure I properly clean when necessary, whether that is an IV port, the patient's medication site, or simply just performing hand hygiene. Lastly, I will use the proper procedures for disposing of sharps, avoid charting before tasks are complete, and make sure I complete hourly rounding even if my patient is on precautions. Overall, I am very grateful to have had this experience, and I have learned both bedside and professionalism skills that I will carry with me as I enter my nursing career. One of the outcomes that I anticipate future nursing students will achieve from this course to better prepare them for a career in nursing is advocating for themselves. We are often told to advocate for our patients, and although that is our main priority, we have to make sure that we advocate for ourselves in the process. We must be confident enough to create boundaries and stand up for ourselves when we are not receiving the treatment that we deserve. Burnout is real and can occur very quickly if we do not take the necessary time to ourselves and avoid overworking ourselves. In this course, students will learn how to effectively and professionally express their concerns. Another outcome that I anticipate future nursing students will achieve from this course to better prepare them for a career in nursing is time management skills. Balancing practicum shifts while also still managing the complete coursework for other classes and study for exams requires a great amount of time management skills and prioritization. Especially if they are in practicum and community health clinical at the same time, students will grow their skills in balancing everything on their plate. Last but not least, I anticipate that future nursing students will achieve learning their new limits and that they are able to push themselves past their current limits, believe it or not. Entering nursing school, I also assumed that it would get easier as you pass each semester, but unfortunately that was not the case. Each semester came with its own challenges, required a different type of adapting, and it often felt like you were starting fresh at the beginning of each semester, especially this one. Taking this course and having to juggle everything that comes with it, especially when it comes to the extremely busy schedule, pushes you beyond your comfort zone and forces you to develop the necessary skills to be successful. I wish the juniors the best of luck as they navigate their last year of nursing. I would also like to thank our practicum professors for guiding us to the finish line and helping us tackle the challenges to the very end. I am very grateful for my practicum experience and cannot wait to see where this next chapter takes me.